Welcome back to East Texas Live on KETK. We're joined now by Dr. McCrell from UT Health East Texas. Thank you so much for being here today.
Thank you. I'm glad to be here.
Absolutely. So today we're going to be talking about safety during the summer and staying out of the emergency room, which, especially during the holidays, it's much more important to be aware of staying safe. A lot of people hitting the road, traveling. So thank you so much for being here. Can you tell us a little bit more about the sun and heat exposure? What we should be worrying about is the temperatures are getting closer and closer to those triple digits.
Absolutely. Absolutely. We've been very lucky to have a pretty mild summer so far, but as those temperatures begin to spike, we really do start to get concerned about those heat-related illnesses. The big thing that we're looking for is dehydration. As we get out into the heat, we want to make sure that we're staying hydrated well, plenty of water during the day, staying away from things that are heavy on caffeine, also being careful with alcohol. It tends to dehydrate us more. The big thing that we really are looking for is that significant heat exposure begins when we start talking about heat exhaustion, which can turn into heat stroke. And signs for heat exhaustion are when we have increased thirst. You'll note that you'll stop sweating as much as you are normally, and that your core body temperature will start increasing. When this happens, sometimes nausea and vomiting can set in, and that's really when we want to see you come into the ER, because if you can't tolerate fluids by mouth, you're not going to be able to get yourself rehydrated, and that's kind of the hallmark of heat exhaustion, and that's time to come on in. The other big warning I like to give about heat-related exposures, especially is our young children. Young children don't have the same ability to modulate their core body temperature the way that adults do, and so you really got to make sure that you're getting your kids inside for a good break to cool off, lots of water, and make sure that they're taking time to be safe. Sunscreen too, that's a big one.
So speaking of the kiddos, that's who we're always the most worried about. When it comes to swimming, whether it be pools, lakes, are there specific risks that we should be watching for?
Absolutely. We've known for quite a long time that one of the #1 causes for death and injury in children in the United States is actually accidental trauma. And over the summertime, the pool, the lake, those are the big things that we start looking after. Boating-related injuries, we start seeing a big spike in those. So the big thing that I always recommend is having a realistic idea of what your child's swimming capabilities actually are, especially in our young kids that quite aren't up to speed yet. I always recommend using an appropriate flotation device, and when I say flotation device, I mean a life jacket that's actually made for it, not like a pool inflatable or one of those foam noodles that people use. The other thing is the buddy system is key, and it should be an adult paired to every child to make sure that we're keeping an eye on them. That's really the safest way for us to reduce any of those types of injuries. The other thing is, if you are going out to the lake and you're enjoying the boat and doing some skiing and things along those lines, really just making sure that we're keeping adults and children away from the back of the boat if they're in the water. We do see some pretty big propeller injuries that come in from time to time, and that's one of the safest ways we can avoid those.
So since we have you here this holiday week, fireworks, everybody's always getting hurt sending us off.
Yes, absolutely. We always joke that it's not the 4th of July in the ER until somebody's come in with a firework-related injury.
Someone or some people.
Yeah, absolutely. Safe handling of fireworks is really the #1 key. Making sure that you have one dedicated person that's managing the fireworks show. We all like to set off fireworks and do our own small displays from time to time. And really, just like you would designate a driver, we would always say designate someone to set off the fireworks that's going to be in charge of those. Make sure that you've got your fireworks going off in a safe area that's kind of cornered off from everybody else. And really the biggest injuries that we see that occur is when you get a dud. And so you've lit the fuse on the firework fails to go off, and human nature is you want to go and inspect and see, well, what happened? And all of a sudden we get an unintended detonation, and that's when we see our worst injuries. So I like to just make sure that you've got a water source available, like a garden hose or a fire extinguisher nearby. If you do wind up in a situation with a dud, make sure that you're soaking or saturating that firework completely. Try and move away from it, leave it overnight till the morning, and then dispose of it safely.
All great tips. Thank you, Doctor. If we want to find more information from you guys, where can we do that?
You can absolutely find us on Facebook at our UT Health website, as well as on other forms of social media.
All right. Thank you so much for being here today.
Thank you.
All right.